Good morning. I got a question about vaccinations and the fever that comes with them. What should we do? In general, we've made full episodes about vaccinations that you can watch. Today, I'm going to talk about the fever that comes with vaccinations. Of course, the mandatory vaccinations in the early years of life can cause a fever. This fever is a reaction from the immune system to the vaccine that entered the body. The fever usually appears on the first day after the vaccination and can last for up to 72 hours. Some vaccinations cause a higher fever than others, like the Hib vaccine, the meningococcal vaccine, or the DTaP vaccine. The fever from these can be higher than from other vaccinations. With some vaccinations, the fever can appear after a week, the body can remain dormant, and the immune system's reaction might appear after a week or 10 days at the most. There are two such vaccines, the measles vaccine and the MMR vaccine. These can cause a fever to appear after about a week. As for the other vaccinations, the fever usually appears on the first day and typically doesn't last more than 48 to 72 hours. The fever can be low grade or it can be high grade, meaning it can be a slight fever or it can become a high fever. There are no other signs of infection with this fever, so we don't worry about it. We just give a fever reducer. So should we give a fever reducer before getting the vaccine? For only some vaccines like the Hib or the meningococcal vaccine, you can give a fever reducer before the shot and then every 6 hours for 1 day. However, the standard routine is to wait and see if there's a reaction and then give a fever reducer. Warm compresses on the injection site can help with the pain from the shot. Don't worry about a post-vaccination fever. It doesn't last more than 72 hours. For a few specific vaccines, a mild fever might appear after a week to 10 days, but it's usually not a high one. That's why before vaccination, we must first check if the child is sick. If they are, we postpone the vaccination until they are healthy and eligible for the shot. This is to avoid an overlap between a fever from the vaccine and a fever from the illness, which could result in a very high temperature and be a problem for the child. So what fever reducers do we give? We give paracetamol, which is the safest option. We give it every 6 to 8 hours according to the appropriate dose for the child's weight. In severe cases, we can give ibuprofen if there's severe pain from the shot, but paracetamol is safer and better in these situations. I hope you found this video helpful. If you'd like others to benefit as well, please like and share it. Stay safe, everyone.